Hello everyone, this is Hamaiyal Sana and it's a pleasure to be with you all today. The study that I'm presenting today is the demographical analysis of COVID-19 spread in Pakistan, a step towards contact tracing. The study was to analyze and confirm and understand the pattern of emergence and spread of COVID-19 in the southwestern province of Pakistan. This province is also known as Balochistan. This region was later recognized as the receptacle of first confirmed case of COVID-19 in the country. Presenting to you now is the geographical map of the country of Pakistan, and I hope from this map you can appreciate the position of Balochistan and its presence as the largest geographical province of the entire country. I hope you can also appreciate that it shares two borders with two different countries, the first being Afghanistan and the second being the Islamic Republic of Iran. Global statistics. At the time when the study was concluded was 19th of April, and at that time the whole world was looking at 2 million cases of COVID-19 worldwide. At the same time, we also saw the death toll to be calculated as 152,000 even after rigorous containment and quarantine efforts worldwide. Meanwhile, to give a picture of Pakistan, the statistics reported were 7,993 cases, out of which a total of 159 deaths from coronavirus were recorded so far. Around the time when the initial cases of COVID-19 emerged in Pakistan, the number of cases had also massively surged in two of its neighboring countries, one being China and the other being Iran. Pakistan shares busy travel and trade borders with both of these countries. At the time when COVID-19 emerged as a health threat, there was also the influx of the religious travelers, also known as Zairene, entering from Iran to their home country of Pakistan after performing their religious pilgrimage in the country of Iran. With the influx of these travelers, Pakistan saw a rapid rise in COVID-19 cases, especially from the region of Balochistan, which shares the border with Iran. Therefore, Balochistan has significant geographical importance for the COVID-19 outbreak in Pakistan, and that is what we endeavor to do by delivering this study from the first reported place in the country of Pakistan for coronavirus. The primary aim of the study was to understand the mechanism of the spread of COVID-19 in the biggest province of Pakistan. Through this, we also wanted to develop strategies for effective contact tracing and control the spread of the viral agent in the region. Talking about the methodology, the study design, our study was a cross-sectional descriptive analysis that was carried out in the province of Balochistan. The study analyzed medical records from 10th of March, which was around the time when first case of COVID-19 was reported in Pakistan, till 19th of April 2020. Inclusion criteria. The study included those patients that tested positive with real-time polymerase chain reaction, whereas patients that tested negative were excluded from the study. Data collection. The data was taken from the dashboard of COVID-19 cells supervised by the Director General Health Balochistan. The COVID-19 operation cell manages the data for the COVID-19 and contains the demographics of the patient who were tested for the virus. The provincial COVID-19 operation cell is supervised by the government of Balochistan, as we mentioned before. However, it is also with the collaboration of the World Health Organization, UNICEF, and the Field Epidemiology and Laboratory Training Program FELTP Pakistan. Ethical considerations. The data in the dashboard was de-identified, therefore permission from the ethical board was not needed. Statistical analysis. The data was analyzed on SPSS version 20. Demographic characteristics were summarized using descriptive statistics. Categorical variables were measured as frequencies and percentages. Data were grouped into age intervals, and cross-tabulations were made for desired characteristics, which will be shown in a very short while. Let's talk about the results now. First, let's talk about frequency of the test results. A total number of 5,315 tests were conducted in the time duration of the study. Out of these 5,315, 432 cases came out to be positive, whereas 4,883 cases came out to be negative for COVID-19. Now I'm presenting you this diagram to show you the status of COVID-19 cases as of 19 April. As you can see in this pie chart, around 63% of the cases, of the positive cases, were active. Out of these, 35.64% or around 36% were the cases that had recovered, whereas 1.15% were the cases that had succumbed to death. Talking about demographics, we see that out of all the positive cases, 308 of them were male, making the majority population. Talking about the age group in years, we see that the majority of the cases reported for COVID-19 belong to the age group of 21 to 30 years of old, which was followed closely by 31 to 40 years age group, making up total of 95 positive cases for COVID-19. Talking about the lab reporting site, we see that there were two main sites from which we collected our data. The first being the Fatma Jinnah Chest and General Hospital, making up the frequency of 427 cases recorded, and then the other one being the Taftan Mobile Lab, making up the frequency of 3 cases recorded. The Taftan Mobile Lab was a mobile lab that was established in the city of Taftan, which is a city which shares its border with the Islamic Republic of Iran. COVID-19 spread route. In our study, we try to classify the source of entry or the source of spread of COVID-19 into 3 major ways. The first one being international travel, the second one was being domestic travel, and the third was local spread. I hope you can appreciate from this table that the majority of the cases for COVID-19 emerged from local spread. And when we delve deep into this, you can also see that most of the local spread cases arose due to contact with the positive case of COVID-19, making up almost 165 cases collectively. On the other hand, we also see that almost 128 cases for international travel were due to international travel, and out of these, almost 125, making up a vast majority of the cases, arose from Taftan, which as I mentioned earlier, is the city which actually shares its border with Iran. Attack rate of COVID-19 in districts of Balochistan. In this table, we have tried to draw on the geographical statistics of Balochistan. Balochistan itself has been divided into several districts, each being a different part of the province and representing a different population. The first thing that I want to highlight here is the city of Koira, which is the capital city of the whole province. And I hope you can appreciate that it made up of almost 328 positive cases for COVID-19, making up for the attack rate of 14. It was followed closely with another district at the right at the bottom called Mastong, which made up a frequency of almost 13 cases and making up the attack rate of 4.8. And I hope you can also appreciate the different districts with different attack rates and different population and different frequencies of the cases of COVID-19 that appeared at different time durations, which we'll be talking about in a short while. Here we are, timeline of the positive cases. In this table, we try to draw on the timeline from the time when the first positive case of COVID-19 was confirmed till the time of the conclusion of the study. As you can see in the beginning, from the 10th to 15th of March, there were only 17 cases. However, we saw a massive surge in the next few days from 16th to 20th of March 2020. Then we see a period of stagnation in which we saw no initial rise or fall of cases for the next few days. However, these cases again surged after 31st March 2020, and then they went down again. And then we see them surging to 58 from 10th of April. And then we see the crescendo being the highest number of cases, around 146, recorded from 15th to 19th of April 2020. And I hope you can appreciate from this table how unpredictable and unfamiliar this spread was and how it was surprising for so many of us. Virus spread timeline with its route of entry. In this table, we have tried to draw on the sources of the spread of the COVID-19 and also the timeline. And I hope from this table you can appreciate that in the beginning of the few days, we see that most of the cases were due to international travel. However, as we move down the timeline, we see that the cases begin to emerge in a more frequency, in a more drastic frequency, and it also begins to spread due to the local spread. Yeah, so this is a very interesting graph. Now let's talk about the characteristics of the mortality. In this table, I want to first elaborate that we saw an overall of 5 cases of mortality due to COVID-19. Out of these mortality rates, almost 3 of them were males. Talking about the age group, we saw that 2 of the deaths were in the 41 to 50 years of age group, and the other 2 were from 61 to 70 years of age group. All 5 deaths were reported from the district of Quetta. The route of spread of virus, I hope you can appreciate this as well, that it was majorly due to local spread, but it was followed closely with the international travel. Implications. The majority of the cases from our observation belong to the age group of 21 to 40 years of old. The mortality rate of Balochistan was recorded at 1.15% as of the day of this article being reported, that was 19th of April, representing an overall of 5 deaths in the region. Most of the deaths were recorded in patients over 40 years of age. Majority of the deceased had contracted the virus through the local spread, with only 2 patients succumbing to the disease who had a travel history in the last few months that we mentioned before, with it being majorly Iran, but also some from Saudi Arabia and United Kingdom. The spread route of the virus was divided over the 3 main sources, with the primary source recognized as the international travel, the primary source being the first one which initiated or introduced the virus in the region. The religious pilgrimage of multiple communities in the month before showed an alarming number of cases confirmed in Pakistan on their return. The positive cases increased 9 times in the space of a mere 40 days, highlighting another crucial point of the course of the entry of virus in the patients. The route of entry through the local spread of the virus was seen to increase by a drastic number of 137 by 19 April from a single case reported in March 2020. Conclusion. The study is the first one that provides the first account of COVID-19 epidemic curves in the country of Pakistan. We observed that the mortality rate was comparatively low at that time. A few probable reasons were that the age group of patients positive with COVID-19 were mostly under 40 years. The geographical and socio-economic barriers of the low middle income country of Pakistan make access to timely diagnosis and treatment a big problem, which led to underreported cases in Balochistan as well. However, we also understand that this was the first report from Balochistan, and it may be difficult to predict the course of this virus and its impact in the coming future with just study alone. The data displayed herein was acquired firsthand from COVID-19 cell supervised by the Health Department of Government of Balochistan and its collaborators that proves the validity of the data. All of the cases in this study were confirmed by RT-PCR, which was the only reliable screening test recommended by WHO to ensure a COVID-19 patient at that time. Moreover, Balochistan is the least population-dense province of Pakistan, and it is spread over a vast geographical area that I showed at the beginning of my presentation. This has led to lack in access to basic healthcare services for a big part of the resident population over many years, which has led to low quality in health services and inaccessibility at many points. Therefore, limited testing facilities, meant a limited number of people could be screened for the virus, which could factor in the low disease burden observed in this study. In the light of this study, a clear picture of the scenario of the spread of COVID-19 in Balochistan was portrayed in the beginning months of its spread, which contributed to effective contact tracing in the region. The study points out 60.6% of COVID-19 patients contracting the virus via the local spread, with the highest attack rate coming from District Quetta and Loralai. Since Balochistan has a scattered population with an underdeveloped healthcare system in rural areas, only limiting testing had been performed so forth, which was not considered a score point for fewer cases in the region. As suggested by the study, the recovery rate was quite significant in the region, but proper follow-up of the recovered cases was still highly recommended to ensure timely notification to the authorities in case of any late complications. A thanking note: I want to thank all the members of Bolania's Research Forum and the cooperation of the Balochistan COVID-19 Operations Cell for their help in putting the study together. I'm also grateful to SciTech Central Conferences for giving me the platform to share my work with my colleagues and peers from all over the world. I hope you all a very good day and best of luck.